Hello and welcome to the Pelvi podcast. My name's Robert Cormican.
Hello, my name's Aoife Niocchi.
Aoife, would you like to tell the audience a little bit about yourself?
Yes, Robert. So my name is Aoife. I'm a clinical specialist physiotherapist working in Galway, which is in the west of Ireland.
Very good. So, Aoife, would you like to talk a bit about what we're going to be talking about today?
Yes, Robert. Today I thought we might talk about a subject called bladder retraining.
Very good. So, what is bladder retraining?
So, bladder retraining is an exercise that a specialist pelvic physiotherapist might do with a patient who might have a bladder problem.
Very good. So, how exactly does it work?
Okay, well, when you have a bladder problem, for example, your problem might be that you empty your bladder and you think you're finished, and a few minutes later you have to go back to empty again. We call that urinary frequency. It can be a problem for the patient, for a man or for a woman, that affects them during the day, and it can also affect them at night time. It can be particularly troublesome if you're repeatedly woken from your sleep during the night with the urge to empty your bladder. Other problems that you can have with your bladder as well are that you are very uncomfortable. You feel pain in your bladder, you feel a sort of a pressure to empty, yet when you go to the bathroom you don't pass much urine. Also, there can be a problem that you have leakage. In men in particular, they can have leakage after they empty their bladder. We call that post-micturition dribble. So when a man empties his bladder, sometimes there's a few dribbles of urine after they empty. Now, we say that a few drops is normal, but anything more than a few drops is not normal. This can affect women as well, and for example, if a woman gets an overwhelming urge to empty her bladder and it's so strong that she doesn't actually make the bathroom in time, and she can have a leak, the urine can leak.
That's a very good description. I find myself, while I wouldn't have pain, I wouldn't really be extreme. But what I find sometimes is I go to the bathroom and I'm fine, and then 5 or 10 minutes later I need to go again. How does that happen, or why does that happen, and how can I prevent that?
Yeah, now it can be for a few reasons. It can be to do with the bladder muscle itself being overactive, giving you the sensation that you need to empty your bladder when you don't really need to empty it, that you've just emptied it. Also, though, you can get that sensation or urge to empty your bladder if you haven't emptied it properly. And another reason is if your pelvic floor muscles are weak, you sometimes can have that sensation. Your pelvic floor muscles are muscles in the base of your pelvis. They're muscles that you can't see in your body because they're internal, but they work really closely with your bladder and your bowel to ensure normal filling, storing and emptying from both the bladder and the bowel. They're also really important to support your organs, and they're also really important in men and women for normal sexual function.
Very good. So I remember before the show we talked a little bit about bladder stretching, where you drink too much water and then you go to the bathroom, but your muscles, the pressure put on your bladder isn't enough to empty it all, so you need to go to the bathroom again 10 minutes later. I think you said that might be what I have. Could you talk a little more about that?
Yes, Robert. Sometimes that can happen. I suppose if you overfill your bladder, so if you've been drinking a lot, large volumes, sometimes the volumes then that are in your bladder are greater than, or they exert a pressure which is greater than the pressure that the bladder muscle can exert to empty the bladder. So let me explain that a little bit further. So bladder capacity varies between people, and at the hospital we have ways of testing it to see what each individual person's bladder capacity is. But for example, let's say your bladder capacity is 500 mils. So if you have a problem where you're getting some urgency to empty your bladder, you're getting a little bit of frequency, you mentioned you had just been to the bathroom and you thought you emptied, and then you're getting the urge to empty again. We put you through lifestyle changes that we call bladder retraining. So what we do is we talk to you about how much to drink, when to drink, how to empty your bladder, how to use your muscles to control the bladder, and I suppose how to train both the pelvic floor muscles and the bladder to work normally. So in relation to fluid intake, you might wonder, what's the right amount to drink? How much should we drink? What's good for a healthy bladder function? You hear mixed messages in the media. We all should be drinking 5 litres of water a day, or we all should be drinking 2 litres of water a day. So it really depends. Now, if you have a bladder problem where you have urgency, where you're getting strong urges more often than you did one time to empty your bladder, and it's uncomfortable, or you literally have to go, you have frequency, you have to empty. When you're up at night, we call that nocturia, when you're woken with the urge to empty your bladder, or even, you might have some leakage. So we ask you to start monitoring your fluid intake. And what we recommend is that you might take, around 250 to 300 mils of fluid every 3 hours, 6 times a day. So that would mean that you would have a drink in the morning, you would have a drink mid-morning, you'd have a drink at lunchtime, mid-afternoon, maybe evening, 6 o'clock, and we recommend that you have your last drink at 8 o'clock. So, for example, at 8 o'clock, you put on the kettle, you empty your bladder properly and carefully, the way we show you, and we might talk about that in a moment, Robert, and then before you go to bed, you empty your bladder again. So by not drinking too late, for example, by drinking at 8 o'clock and emptying again before you go to bed, you're going to bed with an empty bladder. And growth and repair takes place best, we think, in the cells of an empty bladder. So if it comes to, for example, 4 o'clock in the day and you think, oh my God, I haven't had much to drink, it's a little bit late in the day to try and load fluid. So I would advise you to drink, a certain amount, let's say 250 to 300 mils. That's sort of half filling your bladder. So if you drink that every 3 hours and you remember to empty your bladder every 3 hours, then you have a nice, what we say, bladder cycle.
That's very good. But one question I would have is, what happens if you're doing a high endurance sport, say for example like rowing or endurance cycling, where you're on the bike or you're in the boat for 2, 3, even 4 hours at a time? And I find when I used to row, I'd be drinking lots of water because I'd be pushing myself so hard, but I'd be up at the lake 10, 15 kilometers from a bathroom, unable to, having a really bad urge to go. How do you combat that?
Yeah, very good question, Robert. Now, a race situation, a competition day, certainly is, extraordinary circumstances, in your training as well. I was saying to you, there are exceptions to the rule. So what I was talking about in bladder retraining and, having the 250 to 300 mils every 3 hours, that's sort of for a quiet day, a regular day when you can do that. So if you're, definitely if you're exercising, you're burning off that fluid, you're sweating out that fluid. So certainly you are going to need a little bit more fluid. But could I just say to you, it's really bad not to empty your bladder every 3 hours. So, to put it off, if you say, oh no, I can't, I'm up the river, I'm, just to let you know that urine gets concentrated after 3 hours. So a bit like what we talked about at the start of our interview here, if you do overfill the bladder, it is hard to empty it because of the pressure difference between what the bladder muscle can generate and the pressures that the fluid within the bladder are generating. So I suppose I would counsel you to not drink too much while you're training, but certainly reload afterwards. Drink what you can to keep yourself going, right? And maybe, a mouthful every half hour, but certainly hydrate more afterwards when you're finished. But definitely empty. Do not hold on to the urine longer than 3 hours. Now, just as well to say that stress and anxiety and fatigue, they can make symptoms of urinary urgency worse. We always say that the bladder is close to the eye. So if you're stressed, if you're under pressure, you will have urgency. So, you will want to perform well. You'll want to have a good training session. So if that means emptying your bladder more often than 3 hours, that's absolutely fine. We'd also say exceptions to the rule are, if you have a tendency to urgency and frequency in an overactive bladder, we would say that certain foods and fluids will aggravate the bladder. So coffee, Coke, chocolate, alcohol are known stimulants. So if you meet your friend and you have a mug of coffee, you might necessarily hold that for 3 hours, but that's fine. Other days you'll try and test the bladder and try and hold it. So just one thing that's important to say, you can use these pelvic floor muscles that we talked about, these muscles in the floor of your pelvis, to dampen down an urge to empty your bladder when your bladder isn't really full. So maybe we might talk about that for a moment. So when the bladder and the pelvic floor are working perfectly correctly without any dysfunction in either muscle, the brain sort of regulates a communication between these pelvic floor muscles and the bladder muscle automatically without you being aware of it. But when the muscles weaken, one or other of them, that mechanism doesn't work as well. So we find that if you can actively use the muscles in the floor of the pelvis when you want to delay going to the bathroom. Now, if you're sure that your bladder isn't full, so for example, let's say at 9 o'clock you empty your bladder, you fill up your bladder with 250 mils of water, and an hour later you're getting the urge to empty your bladder. So, you kind of talk to yourself and say, well, look, I just went an hour ago, I emptied my bladder well, I've had 250 mils to drink. Aoife was saying I should be able to hold that for about 3 hours. What you can do is contract the muscles in the floor of your pelvis, and it will dampen down the contractions of the bladder muscle. We call that initiating the deferment reflex. And by doing that, you train up the muscles in your pelvic floor, and what should be an automatic reflex becomes an automatic reflex again. And one simple way to do that, now there are a few ways to do it, but one simple way to dampen down bladder urges, if it's ahead of when you want to go, or if it isn't convenient to go, is to tighten your back passage muscle as if you're trying to stop yourself passing wind. You can do this any old way. Don't worry about the technique. It doesn't have to be perfect. But the cue is to imagine that you're at a party, you're trying to stop yourself passing wind. So we would recommend that you do this 6 or 7 times. You just hold the back passage muscle on for about 1 second. And we recommend as well that you stay still when you do this, so you don't actually physically move. If you were to jump up out of your chair, there'll be a physical movement in the bladder muscle itself, and this can cause the urgency or even the leakage to be more severe. So we would ask you to do 6 or 7 quick 1 second holds of the back passage muscle, and just allow that to steady the bladder. You may well then walk calmly to the bathroom and empty. We also think it's good to think of a complex cognitive task as well. So once you've contracted your pelvic floor muscles, you could maybe start to recite the alphabet in your head backwards, or some other complex thing, just to take your mind off, to distract your brain from the strong urges. And that's one thing that's very, very good. But again, you need a certain amount of strength and function in your pelvic floor to achieve that. And Robert, just then to talk about, you mentioned you emptied your bladder and then maybe 10 minutes later you might have to go back to do it. I think it's important to say that we need to take time emptying our bladders. And with the men that come to see us, as well as with the women, we recommend that they double void. So what that means is that, they empty their bladder. Now again, we recommend that both men and women sit on the toilet seat and lean back against the cistern. We recommend that you're sort of conscious that you're in the bathroom emptying your bladder. We like to remind the patients that urine doesn't flow out of the bladder, it has to be squeezed out. And sometimes we can just be rushing, and that we get up from the toilet or walk away from the urinal, if you're a man, without actually being finished. So we recommend that you sit, lean back against the cistern. We think leaning back sort of straightens out the anterior portion of the bladder, Again, we feel it helps certain muscles to relax, and the muscles that we want to contract, it helps them to contract. So empty in that position, and then when you think you're finished, we recommend that you lean forward and try to empty again. Now, some people, when they do that second emptying or that double voiding, they'll find, oh my goodness, I'm actually passing another, good volume of urine. And they do actually finish, and then they don't need to go back 10 minutes later to empty. They'll find as well that particularly the men and also the women, that post-void leak that they've been getting isn't there anymore. Now, some people will find that they're not emptying anything on the second void, but we still recommend, if you have symptoms of urge incontinence, urinary urgency, urinary frequency, post-micturition dribble, that you do this, because even though you think you mightn't be passing anything, you always pass microscopic drops, and it sort of milks out that last little bit of urine through the bladder pipe.
That's really interesting. So, another thing I want to ask you about, slightly off topic, is kind of the culture around pelvic problems. We don't really talk about it, not in Ireland, but I mean, even in general around the world, it isn't something you talk about. But what a lot of people don't know is about how common it is. How many...
Yeah, absolutely, Robert. And you're really hitting the nail on the head there. People don't like to talk about bladder or bowel dysfunction or any pelvic dysfunction. They sort of feel a little bit embarrassed. They often think they're the only person with this problem. They don't know that there is specialist physiotherapy available to help train these muscles and train the bladder and train the bowel and train the sexual function and treat pain. And to answer your question, we think 1 in 3 women will have pelvic floor muscle problems. Some of the evidence in men will say that 1 in 9 men will have a problem with their pelvic floor muscles, leading to a variety of symptoms. But really, I think those statistics are just the tip of the iceberg. I think everybody needs to know where their pelvic floor muscles are, know how to train them, and know how to ensure normal bladder function and normal bowel function and normal sexual function. So it's you're absolutely right, but I would say to people, not to put up with these symptoms, not to hide it. People are always amazed that they're not the only people with these problems. And just, Robert, you mentioned there about rowing, and I think you mentioned cycling. And if I could just say, with the men, rowing and cycling are 2 sports in particular that affect the pelvic floor. From the cycling, it can be the contact with the nerves and muscles in the floor of the pelvis that work with the bladder and bowel and sexual organs, that can be weakened by the physical pressure of the saddle against the base of the pelvis, and the same in the hard rowing seat. But just to say, any sportsman, and I see a lot of very fit and healthy guys and women coming into my clinic, and you would look at them and you think, they do triathlons, they're on national teams, and they have a pelvic floor that you would imagine a 100-year-old person would have, a really weak pelvic floor. Now, can I just say about the 100-year-old person, though, age is not a barrier to training your pelvic floor. A 100-year-old person can have perfect pelvic floor. And again, a lot of these bladder problems and bowel problems, you'll hear of an elderly person, in a nursing home, and they're doubly incontinent. It's one of the reasons a lot of people are in nursing homes. It's a fear that a lot of people have that, as they lose their bladder and bowel control and function, they'll end up in a nursing home. But let me tell you that a 100-year-old muscle can be retrained. And just like any muscle in the body, if you don't know to use it, you will lose it.
Yeah. What do you think of kind of the stigma associated with, people who do have bowel problems? They're usually older, in their 70s, 80s, 90s. I suppose what you're saying about how if you don't train them, it does cause problems, by same with not exercising any muscle. But, you were saying you see a lot of younger patients.
Yeah, exactly.
It isn't just old people who get...
Absolutely. Like, for example, people think it's really all associated with having children, with being pregnant and giving birth. But, half the patients that attend my clinic are men, so they're not in that category, at least not at the moment anyway. But say a lot of the guys that come to see me have a condition called prostatitis. And prostatitis is an inflammation of the prostate gland. So when you have pain, these guys can have abdominal pain, pain in their groin, pain in the scrotum, pain in the testes, pain through the penis, pain in their back, and pain is very inhibitory to pelvic floor muscle function. It sort of withers these muscles. So the pelvic floor is below the prostate, the bladder muscle or the bowel muscle, they're sort of above it. So again, the weakness tracks, around it. And so they're the kind of, I see a lot of young men with prostatitis, but I see a lot of men as well, maybe in their 40s and 50s, and they just haven't sought help. They've been put on an antibiotic, and a lot of the times the prostatitis is a non-bacterial form. So giving them an antibiotic won't do any difference, So I suppose they need to get the correct diagnosis and they need to be referred. This type of physiotherapy that I'm talking about is specialist physiotherapy. It's nearly not like physiotherapy at all. But again, these are muscular structures that we're dealing with. That's why physios are involved.
Definitely. Yeah. So another thing I think we should discuss is
Not at all, Robert. Yeah. So, it's actually hard to find the words, when you're dealing with this. It's hard to know, what exactly, you nearly don't know what to ask for. But, just, I suppose, to think about, it's really important that you drink enough, that you don't drink too much, that you drink regularly, that you empty your bladder, regularly. Don't be lazy. When you get the urge to empty your bladder, if everything is working fine, you should have 15 minutes comfortably before you actually need to go. So that's important. But if it's very urgent and you can only hold a minute, probably you have a little problem in your bladder or in your pelvic floor muscle. And it's very important as well not to drink too late, to allow the bladder to be empty when you're asleep. As we were saying there about the double voiding, that's very important. And then I talked to you about a pelvic floor exercise where you contract your back passage muscle. Now there's lots of ways to contract your pelvic floor muscles, and you really need to seek the help of a specialist physiotherapist, a pelvic physiotherapist, because sometimes it's not contracting the muscle that you need to do, it's actually relaxing it. Just like if you imagine your calf muscle, sometimes that muscle can actually be in spasm, and you will have to have therapy to relax it, and your physiotherapist will guide you through that. And then, with your pelvic floor muscles, just like any other muscles in your body, you have to train them. You have to be supervised to train them. The training program has to be at the right level for you. So that's very interesting as well, how you progress your exercises. But there's been great evidence and research done on these muscles, and a specialist physio, a specialist pelvic physio will really know how to guide you through that and how to give you the exercises that are quick, easy, not a problem to you. And when you sort out these problems, any pelvic problem, you can get on with your life. These problems won't kill you, but you certainly will have a much better quality of life. You won't fear aging.
Yeah, that's very good. So one thing I just remembered, when you were talking about prostatitis, one thing I might say is you mentioned pain, but in the lower back, sometimes I get pain when I'd be rowing or doing, long endurance exercises like running or cycling. Is back pain associated with it, or is that?
Yes, it is actually. It is. Now, the pelvic floor, the abdominal muscles, and your deep spine muscles all work together. So, for example, it's very hard to contract your pelvic floor muscles without your abdominal and your deep back muscles coming in at the same time. Now, a weak pelvic floor necessarily mightn't give you back pain. You might have a problem within the joints or the ligaments in your back. You might have been overtraining, the posture that you're, in when you're exercising. But, you should be careful with pain. You shouldn't have pain. It's not normal. Now, you can have a sort of a delayed onset muscle soreness pain, which, is part of the training. Certain types of muscle activity, for example, eccentric muscle activity will give you pain more than concentric muscle activity. So, for example, if you're hill walking, climbing up the hill doesn't seem to be too sore, but climbing down the hill, that is more the lengthening muscle action, and that will give you soreness. But has the back pain cleared now that you've stopped the rowing, or do you get it from time to time?
I suppose I think it could have been my posture. I find my posture has increased recently. And would you say, having bad posture could not only lead to back problems but also pelvic problems and other problems? Or what do you think?
Absolutely. I think posture is key.
I think it was the posture that
Yeah. And again, certain sports, you just have to do that posture for them. A lot of the guys that come to see us with prostate problems tend to sit for a living. So the first thing I'd say to you is avoid prolonged sitting posture. And we know that there's evidence to support it, research to support it, that almost 80% of low back pain comes from poor sitting posture. So if there's any guys listening, or girls, I wouldn't sit longer than 15 minutes without breaking that posture. So if you're at work, if you can do any phone calls in standing, if you can change it, make sure you hold yourself well. It's very easy, when you're tired, to slump and not to be straight. But even if you do make an effort to straighten your posture, like all of our mothers told us, you are actually working the muscles of your tummy and your back, rather than just hanging on your ligaments. And just one very important thing too, Robert, I think to say is, to maintain a normal body weight. We have a terrible problem in the world with obesity, and being overweight is not good for your back. It's putting extra strain on all of your joints in your body. But we have some guidelines from the European guidelines, the NICE guidelines in particular, in relation to bladder problems, and these guide us in women. I pretty much would feel that it's true in men as well. But if your body mass index is over 30 and you have bladder problems, you are advised to try and lose weight. And really, body mass index of 25 is really what's indicated. Can I just say as well, any exercise is so good. Do what you like. You don't have to be going to the gym, although the gym is really good. I think men in particular, from an early age, to regulate their hormones, there is some new evidence coming out that they really do need to be doing some weightlifting, safe, under the supervision of their gym instructor or personal trainer, and that they really do need to lift some weights, to strengthen and to bulk their muscles and to keep fit. And as well, exercise is so good for stress relief. And again, I know we touched earlier on in the interview that stress can give you some bladder symptoms. When you're stressed, you're not breathing right. If you're not breathing correctly, that can even cause a bit of pressure on your bladder and on the muscles in the base of your pelvis, I suppose, as well as your back. So definitely watch the posture. Remember to keep your general exercise up. Remember to breathe. Don't be too stressed, and keep going.
Definitely, yeah. So one thing I think you mentioned, which I think is very good, is how you should get up every 15 minutes, and how a lot of people suffer problems because they're sitting at a desk for prolonged periods. But there's a new trend with kind of height adjustable desks, that they're on a timer, and kind of stand-up desks. They move, they're electric or they use hydraulics.
Yeah, I've seen those desks. I think that's a great idea. If it encourages you to change your posture, yeah. And your physiotherapist can show you what's a good posture for you, what's a good height for you. Tall people need a higher chair. Smaller people, sometimes the standard chair is actually too high for them. And I suppose, Robert, not only to think of the people that sit in an office, to think of the people that sit when driving.
Yeah.
That can particularly affect them too, to remember to get out of the car, not to stay longer, any opportunity, even just to break the posture for a few seconds, it's very good. But Robert, could I just say as well, in case of any of your listeners have any symptoms, I suppose to the men that might have new bladder symptoms, They might be up at night a little bit more than they were. They might have even have trouble emptying their bladder, even though I'm saying take your time, double void, lean back, try sitting rather than standing at a urinal. If you have any concerns, do go to your family doctor, your GP. Your GP will take blood tests, your GP will examine you, and your GP will send you possibly to a specialist doctor if you're a man, who would be called a consultant urologist. And if you're a woman, you can have exactly the same symptoms, and again, your GP will take some blood tests, they might sample your urine, and you might find yourself referred to a urologist, a consultant urologist, or a urogynecologist. So again, that's possible, but don't worry. People are often very worried about a cancer diagnosis, which of course, with anything to do with the prostate, that's men's first worry. Yeah. But just to say, there are a lot of benign, a lot of non-cancer prostate-related symptoms that are so treatable with physiotherapy and advice and medication, sometimes from your doctor. And that you don't always need surgery, but sometimes you do, in both men and women. But for sure, try pelvic floor muscle training, and some of the bladder retraining tips that we talked about. It'll certainly stand you in good stead.
A lot of people are kind of nervous when you mention the word surgery, but there's a lot of alternative options. Like, you do a lot of exercises, and you're using a lot of new high-tech technologies, like the electromagnetic chair you use, which wirelessly stimulates muscles, because traditionally you'd have electroshock therapy where you'd attach electrodes or even needles and use them to stimulate the muscles, whereas the new one you use, it's wireless. Could you talk a bit about that and what the technology behind it?
Yeah, I'd be delighted to, Robert. So yes, we do use electrotherapy for pelvic floor muscle training in certain cases, depending what the physiotherapist will find. So for example, if you have overactive bladder, if there is a problem within the bladder muscle, there is evidence of using electrical current to dampen down the signals or the overactivity. There's also evidence then that if you can stimulate the pelvic floor muscles, that by stimulating and strengthening and bulking those certain particular fibers, the type 2 muscle fibers, they're very prone to atrophy, to getting thin and skinny, just like any other muscles. So you can think of the electrotherapy like bodybuilding for these muscles when they're very weak. But you must remember that it's actually stimulating the bladder itself in a sort of an automatic way. So that, the two jobs the electrotherapy does is strengthening, bulking, and working on reflex function, that inhibitory reflex that I was telling you that the muscles do. So we have a variety of techniques, and we are getting great results in my clinic with a new type of therapy that's come from Switzerland called the Pelvi Power. And what's great about the Pelvi Power is it's a very intensive therapy. You mentioned that it's wireless, so it is. So there's no need to take off any clothes. There's no need for any internal probes in your body like some other samples. There's no need for big electrodes that attach on. And plus, this new Pelvi Power therapy is a really short therapy. It's 15 minutes only of intensive pelvic floor training. It's really comfortable. It's not painful.
One thing I might add about is when a lot of people think of electrotherapy, they think of being shocked, they think of pain. But I've tried the chair, and it's you feel no pain whatsoever. You do feel the muscle kind of contract and be stimulated, but it's like you're being lifted almost. You don't feel any pain. And again, when you said intense electrotherapy, that sounds very intimidating, very scary. But I assure you, tried it myself, and to the viewers out there, it's like being lifted almost. And even on the highest setting, like, there's never any pain. It just feels like you're being lifted, like someone is moving your muscles, and I think that's very kind of the opposite to what you'd think, because electrotherapy does sound like, again, a very intimidating thing.
Absolutely, Robert. It sounds scary, but physiotherapists have always used electrotherapy, and particularly in this area, there's a good evidence of using it, and certainly in my clinic I've been using it for the last 2 decades, different types. But the Pelvi Power chair has come from Switzerland. It's absolutely brilliant. Patients love it. It's quick, it's easy. In comparison with the other electrotherapies on the market, it's affordable. And Pontimed is the company that have brought it to Ireland, and there are a few centres in Ireland and in the UK and in Dubai as well. I was there recently lecturing there and sharing some of my clinical experience. So, Yeah, it's absolutely brilliant. And just to say, the pelvic power is really good, but there are other tools that the physiotherapist will use. Just to say, we have probably about 20 tools in our toolbox that we go through with the patient. And really, the evidence is that it's a mix of the electrotherapy, pelvic floor training, bladder retraining, other things that we might do with the patient. We're often advising on skin and bone and general health as well. And sometimes we have to use manual therapy, like a particular sort of deep massage. Sometimes that's indicated. So it's, it's interesting.
You mentioned a lot of other tools, it isn't just electrotherapy, you need to use a kind of a combination of tools. What are kind of the main ones, and is acupuncture related to physiotherapy, and what other tools would you use to treat a patient?
There is some evidence that acupuncture can be used in pelvic floor therapy. Personally, myself, I don't really use it. I do use a technique which is called PTNS, which is the company that provide that in my clinic. Their name is Cogentix. And the PTNS is stimulating the pelvic floor, bladder and bowel through a nerve in your ankle. It's not painful either. It sounds like it will be painful. And we get very good results with it. We wouldn't use that first off. That's quite an invasive. It's a little bit more expensive. So we sort of have as well as having a toolbox of many techniques, we have plan A, plan B, and plan C. And could I say as well, Robert, that the specialist physiotherapist, we work as part of a team. There's a consultant at the lead of our team. The GP is very important. I work with brilliant clinical nurse specialists, dietitian specialists, skin specialists, a lot of nurses that are involved in tissue viability, and so it's great. So the patient has a few heads working, and in my centre I work in the Bonds Consultants Clinic in Galway. In
Bon Secours,
the Bon Secours. You'll be familiar with the Bon Secours. It's a chain of private hospitals. They're not-for-profit organisations, and there are super clinicians working there. So that's where I'm located. And I do a little bit of consulting work as well. I help other clinics set up and develop pathways that they might use. And I also do a bit of research. And I do some lecturing. I was giving a course there recently in Belfast, and actually that course was on pelvic pain. So again, sometimes when the pelvic floor muscles aren't working right, the patient can have bladder symptoms or sexual symptoms. So erectile dysfunction is something that the men will have, or pain on sexual intercourse is what the women will have, or bowel symptoms. But sometimes it's just pain, and again, we'll devise a treatment plan appropriate to each patient.
So would you like to tell me a little bit more about you mentioned travelling a lot, like to Dubai and Belfast and set up clinics, and what is it kind of like, dealing with people who've never dealt with these kind of advanced technologies? What is it like to train up new people, and how do you think new patients receive kind of technologies that they've never heard of, like the electrotherapy, where they might find it very invasive, or not invasive, but they might be intimidated. How do you find it kind of training up new people who've never seen this stuff before?
Well, I think we have a huge problem, right? So there are a lot of people, men and women, that need help. Now, I'm a clinical specialist, and I really don't believe that every patient needs to see a clinical specialist. There's a lot of routine care and treatment that can be delivered absolutely perfectly well by a trained physiotherapist who has a special interest in this area, but equally by a nurse as well. I studied in the UK, and a lot of the roles are shared. Sometimes you have a clinical nurse specialist and a clinical physio specialist working in the same unit, and we share skills. But to answer your question, I absolutely love travelling with my job. I am very passionate about this area of physiotherapy. I really think the problems are awful, but the results are great. I think it's a real niche area for physiotherapists to work in. I think we've a great skill base that we can really help our patients, but also in helping other colleagues that might have an interest, that are trying to help their patients locally. It's nice if someone doesn't have to travel to attend a clinic. Patients attend my clinic from the four corners of Ireland, and I actually have some patients that fly in from the UK. Now, I really wish those patients didn't need to come in to see me, and thankfully our specialty is growing, but it is still very small. And I know I certainly can't see all the patients that need to be seen. In my area, I might try hard, and I've seen a lot of them. We have some very busy days, but the skills can be transferred. And I'm so excited to work with people with the new technologies because it's so easy and simple. And in the last 12 to 18 months, I have helped quite a few clinics set up, and it's really nice to see them busy now. And I actually got an email now from one of the clinics. It's a clinic in Letterkenny, the Pontimet Clinic in Letterkenny, and the nurse specialist there, Susanna, she's actually running an opening evening on Monday for some local sports clubs. So she was saying, what do I say now to these sports people, that may not have symptoms? How do I, tell them about their muscles? And, but again, she's going to talk about the prevention role. And I do have people that come to me and they say, I don't want to have problems when I get old. I don't want to, I want to train these muscles. My mother told me she had problems, or my father told me, or my sister had a very difficult delivery when she was giving birth to my niece. I don't want to be, what do I need to do? And, it's so good to see those kind of patients, An ounce of prevention is like worth a pound of cure, they say. Definitely. So, but it's great to see new clinics popping up around the place, and to work with new colleagues. And it's super. Yeah, I really enjoy that part of the work. I'm not an expert. I do my best. I try and attend a lot of meetings, a lot of world meetings. I try and, each day kind of improve myself. But what really helps me is seeing my patients. I'm a practitioner. I see patients every day, and I learn so much from them. And their stories and their set of circumstances are never the same. So it's great. It's never a dull moment.
Definitely. Would you like to talk a bit more about your Dubai trip and kind of how the culture's a lot different there? I've heard a couple of people, physiotherapists, say it's very difficult to treat their patients because they don't want to be touched. What do you think?
Yeah, it's a different culture there. Well, I really enjoyed it. So I went to, I worked with two colleagues of mine, Gerard Green, who's a really good men's health physiotherapist from Birmingham, and another physiotherapist, Dr. Khalid, who's a professor of physiotherapy from New York. And we were running a course in Dubai, and it's difficult in Dubai because there is a Muslim culture there, and praying is done very regularly, 5 times a day. They're called to prayer, and cleanliness when they're praying is really important. So if they have incontinence, I suppose bladder or bowel incontinence, it means that they can't pray, and it's a big problem for them. So they're particularly interested in any new treatments. Now, the Pelvi Power that you mentioned is a really good treatment for a Muslim culture in that, they don't really like exposing their flesh. They're covered from head to toe. There are certain, they have certain customs where men treat men and women treat women, or it depends in the area. So you have to respect that.
Definitely.
And they're certainly not as comfortable as we are in the Western world with, taking our clothes off. So yes, and even the physiotherapists themselves who might be from a Muslim background or a Muslim culture, or from, the Middle East themselves, it can be challenging. But we got on really well in our course, and there was great interest, and I've had a lot of contact since from the different people that I met there, and I know I've heard that there are going to be a few new pelvic clinics opening there, so that's going to be great.
Perfect. So, I think we'll end it there. Thank you very much for listening. We'll see you next week. Again, my name is Robert Cormican,
and my name's Aoife Niuki, and if you want to get in touch with me, my email address is ippmphysio@gmail.com. We'd really appreciate your feedback, and any questions that you have, please send them along to us, and let us know what you think, and let us know if you have any other topics that you'd like us to cover, and we'd be delighted to do so. Thank you.
Thank you. Links to our social media and website will be below. Feel free to get in contact with us. Thank you very much. Bye.